Stage 5 is something, a function which is almost less than 10%. So this problem should have been addressed even earlier. They should not be caught, so to speak,
yes,
at stage 5. We should actually make a diagnosis of kidney problems at stage 3 or 4 at least, when the function is about 20 to 30%, literally speaking.
Okay.
At that time, they need a lot of education and come to grips with their problem. You know, try to kind of understand what this is all about and how to limit its progression. And in case it cannot be done, is when you come to stage 5, and if you can't get transplanted, that's one of the very good, best option, what we call for renal replacement therapy, is an option called dialysis. And that is something which the nephrologist should explain to the patients. Sometimes they may not want to hear about it because they have heard all bad things about dialysis. Yeah, but at least dialysis is a bridge to transplantation. Okay. It's a bridge.
And it is, it really is, as you say, it's hard to hear that, but that's where you repeat it, repeat it, repeat it. And as they take it in, totally aside from that first initial, like, you know, that something is so quite dramatically different now in their lives, that you can start to decrease their level of anxiety, which takes that cognition up. And
absolutely, you're absolutely right.
Because again, you're not ever backtracking on that staging. You're hoping to at least make it halt and not progress.
That's true for most cases, most diseases. Some of them can be reversed, but some diseases like, say, diabetes, which led to the kidney disease, then the kidney disease is a progressive one, for the most part.
For the most part. Okay, so now dialysis. Two kinds. We're going to go over the two kinds of dialysis. So probably the least, or the one that you would see more often, and I'm going to go back, I'm going to totally take a time warp now. Okay, so listen to this one. You know, in the 70s I worked at Children's and I worked in the dialysis unit, among other units, and it was very interesting because we had peritoneal dialysis and we had the hemodialysis, and when we are talking about hemodialysis, I have to throw this in because it's really pretty funny, but it is so effective. As with any new technology, there's your first prototype, and it may be a prototype of some technology we use every day for something else. When I first started working with dialysis, we actually used washing machines, and they were some brilliant fellow took the mini basket and converted that into a kidney filter. So we would do dialysis and we would have like a row of machines, and that's how we did it before we came to the, you know, ultra sophisticated, and even now, I mean, smaller, more succinct machines that we have now. But it was as simple as that because you were still filtering and just like you say, washing. It's so simple.
That's true. I would like to say that that must be before I was born, yeah. We have come a long way.
Okay, Dr. Khairullah 1, Liz 0. All right, pal. Let us continue, shall we? Oh, that's a good one. Okay,
but I haven't seen those machines. When I began my training, they were a little bit smaller.
They were smaller. It wasn't a Maytag or a G or something.
That's right, yeah.
To give them all fair representation in the marketplace. But we also did peritoneal dialysis.
Exactly.
And what is the difference between peritoneal dialysis and hemodialysis? Because they have the ultimate same goal, but their method's totally different.
So first of all, I want to re-emphasize the point that transplantation as an option is the best option.
Okay.
It's only for persons who cannot have a transplant is what we call a form of renal replacement therapy, as in a broad term, renal replacement therapy. And what it encompasses is forms of dialysis, and dialysis is a way of sustaining life, and it kind of cleans up the blood so that you don't have the symptoms of the kidney problem. So it is not going to replace the entire function of the kidney. It's only the cleaning up of the blood.
Exactly, right.
So that's why there are these forms of what we call dialysis. And in a broad sense, there are mainly two. And One is called peritoneal dialysis, or we say stomach dialysis for people to understand. The other one is called hemodialysis, hemo meaning blood. And if you want to divide them up, their methods are different. So let's take peritoneal dialysis for instance. And that's the one through the stomach. And what happens in that is that a tube is like a hollow tube is placed literally in the stomach, in your tummy.
In the tummy,
and the lining of the tummy acts like a kidney. So if you put fluid down that tube and it sits in your tummy for some time, it draws out all the waste and maybe excess water, and that's what comes out back from the tube, and you fill it back in a bag.
So your own body really is functioning as that filter membrane that the kidneys are not able to do, the nephrons are not able to do.
Exactly.
So it's going, the fluid is actually going into the peritoneum.
Yes.
Just, okay, in general.
And that's the peritoneum is or the lining of your organs is also a covering, and that is a direct access to the blood. So the fluid is sitting against the blood, and it draws out all the waste and draws out the the excess water, and that's how it replaces, kind of replaces kidney function.
So somebody would have a catheter on their abdomen, but you wouldn't be able to see it, or you?
Oh yeah, well unless you wore a bikini, I don't know, or swimming trunks, and you went to the beach.
But most of the zero still.
But the thing is that for most part, people don't know they're on peritoneal dialysis, and there are cases who there were patients who were great sports figures who were on peritoneal dialysis. This tells you something that despite having loss of the function, they can do a lot of the activities.
They can do life as they
want,
want, as they choose.
Exactly.
All right, so that's the peritoneal, and that's through the Tenkoff catheter.
Exactly. That's the Tenkoff catheter.
Okay. Now, hemodialysis.
Yes.
Because there are some other things. Let me back up for a second, though. Peritoneal dialysis, they can do at home, and they can do it at a time that suits them for the exchanges.
Yes. So when we talked about these two basic differences, we haven't talked about hemodialysis as yet. We also talk about doing the dialysis at home versus doing the dialysis in a dialysis unit or in-center. The one at home is not as used in this country for many reasons which we can talk about. But in hemodialysis, where you literally have a machine, a lot of people may have heard about that, where you have to go to a dialysis center, sit in a chair, and actually the dialysis nurse inserts a needle into the shunt or the catheter, takes the blood out, which is literally cleaned in that machine and returned back to the patient. So the patient is sitting in the chair for about 3 to 4 hours and then goes back home.
As opposed to usually.
3 times a week, you're right. And 3 times a week at a certain time.
Right.
As opposed to doing the same thing at home. So machines have advanced such a lot, and I can't say that it was not available before, but some things, when I was in Iowa about 15 years ago, a lot of my patients actually were doing the home dialysis, the hemodialysis at home. Because of the fact that it is a rural community, and it was great distance between going to a dialysis center, unlike here where there's a dialysis unit almost at every street corner.
There's so many, right, yeah, this is true, there's so many, and that literally, the odd thing about that is, that goes back to a conversation I had with Dr. Hassan Femi, and it had to be like, I don't know, 5 or 6 years ago. And we were talking about dialysis, and he was saying the stats on the trend, and it was something I couldn't even imagine, but now I think about that when I drive down, the street and see another dialysis, another dialysis, another dialysis center. That is exactly so, that it is just growing. All right, so hemodialysis in a center, then the nurse is doing it for you, and you are somewhat of a passive person, though you should never be, versus dialysis at home. But you can't just be at home by yourself doing it. What else do you need at home?
That is the stumbling block, so to speak. So if we